I'm Dr. Mark Rick, and today I'm going to discuss nuclear scintigraphy or bone scan in the horse. Nuclear scintigraphy is a word, a phrase that you'll hear quite often used, but people will use the more common phrase, which is bone scan. And what that is that's a test that we do at Alamo Pintado where we inject a radioactive substance into the horse's bloodstream, then wait several hours and then take it into a special room and obtain images of that horse's skeletal system via the isotope which is in the horse's system. Many times we do bone scans on horses that have what we call acute severe lamenesses, which means it's a lameness that's, the horse is very, very lame and we aren't sure why, but we know we don't want to stand around out in the parking lot or run around out in the parking lot with a lame horse and jogging around and maybe do a series of nerve blocks when potentially we could make that lameness worse. Another reason is if a horse is very difficult to work on, very difficult to say do a nerve block on, maybe he's needle phobic or needle shy and doesn't want you to put needles in him, but yet you want to find out where he's lame, we'll sometimes use the nuclear scan for that. Some chronic lamenesses are subtle lamenesses. You can take images of them, you can do ultrasounds, you can do radiographs, and you can't find out the reason for the lameness. So that's another reason that we'll do it. Some horses have multiple sites where they're lame. They may be lame in the left front and the right hind, or maybe even 3 legs. Or maybe they'll be lame very far up the leg to a point where you can't actually block that area. And again, we can use the nuclear scans or the bone scans to try and locate where those lamenesses are coming from. The camera is the size of about 20 centimeters in size, so it can only do small locations. So each horse that's injected, you have to take multiple views of the horse in order to find where that lameness is. Now many times we know it's in the front leg, and many times we'll even know where in the front leg it might be, like say below the knee or from the knee to the shoulder. We can spend our time looking where we think the lameness is or where we've semi-located the lameness. So we don't have to do the whole body, but sometimes we don't know where the lameness is from or we don't know why the horse is having maybe a behavior problem. So then we'll do what we call a full body bone scan, which actually requires about 55 different views of the horse's skeletal system to get the whole body from the side, from the top, from all the different directions that you need to get a full body bone scan. The bone scan's actually been around in the human market or the human field for about 60 years, and it's been in the veterinary field. It's been done by veterinarians for about 35 years, and Alamo Pintado was the first private hospital, equine hospital, to have a nuclear scintigraphy camera, and we got our camera in 1989, so we've had it for 20 years now.